Hi, I'm Dr. Naveen Al-Salah with eZeLiving.com. Today we're going to be talking to Kay, who's a colon hydrotherapist and a certified nutritionist. Our topic is going to be about digestive health. So Kay, I'd like to ask you, why would someone go see a colon hydrotherapist?
Oh, for many reasons. The most common complaint in this day and age is constipation. Diarrhea, IBS, dehydration, many reasons, and colon hydrotherapy treats not only that, but also the emotional factor that comes into play, in addition to the physical appearance of someone. For example, if they've got bad skin or dark circles under their eyes. Bloating is a huge problem in this day and age, flatulence, gas. So colon hydrotherapy can treat all of that.
Why is digestive health so important?
It's fundamental because, in my opinion, and a lot of people will agree with me on this, the colon, or the large intestine, is probably the most important organ in the body. If the colon is out of balance, or we have some sort of dysfunction going on in that region, the effects ricochet in all other areas of the body. For example, dehydration of the colon can have an effect on the outer exterior of the body, so your skin can look dry, has an effect on the liver, has an effect on the kidneys as well. So the main focus right now, we should really concentrate on the colon itself. Once that's moving properly, everything else starts to have a positive effect.
And what do you think is the main problem right now with most of the cases that you see in the clinic?
On a daily basis, the most common complaint that I experience is constipation. And you'll ask any medical doctor the same thing. The most common symptom that they treat on a daily basis is probably constipation. And there are two ways to treat that in the mainstream. On the medical side of things, and I'll probably get shot for saying this, but they like to prescribe laxatives. Whereas colon hydrotherapy, what we try and do is get people off laxatives and help with colon hydrotherapy in order to hydrate them, because laxatives dehydrate them. Colon hydrotherapy also helps to promote peristalsis. So if you look at the colon as a whole, the muscle of the colon is always going like this. It's always contracting and the muscle, okay? Now with laxatives, that can make it very lazy. So, and as I said, laxatives dehydrate. So colon hydrotherapy, what you want to do is rehydrate the colon, get it moving again, and getting the waste out.
How does someone know that they're constipated?
In an ideal world, we should be going to the toilet 3 times a day. As you mentioned to me earlier, look at a baby, an infant, they're always going to the toilet after a meal. And as humans, as adults, we should do the same thing. So I will ask a patient, how often do they go to the toilet? And they'll say, oh, every 2 days, maybe every 3 days. In that instant, they're actually constipated. So in an ideal world, looking at the bigger picture in this day and age, we can be happy if we go once a day. And that's okay. So that's how many times we should be going to the toilet.
And how does one get constipated?
Oh, many things. Bad diet, lack of exercise, shift work, getting out of our daily routines, lack of water, stress factors, emotional factors. The main thing though is probably diet.
As a chiropractor, I've seen a lot of people with low back pain, and it's mainly linked to their digestive health. Have you seen that in your practice?
Oh, absolutely. If you look down the spine, you've got the different regions of the spine, the lower, the lumbar area, that is directly linked to the colon. So if you see that nerve connection, and a lot of patients who come in complain of lower back pain with constipation, and after the treatment they go away and they suddenly say, oh, I have no more back pain, low back pain. And it's that connection, that link. That's why chiropractic health is so closely linked with colon hydrotherapy in such a positive way. And as colon hydrotherapists, we're trying as best we can to integrate as many medical modalities as possible. And colon hydrotherapy should be a tool in order for those medical modalities to reach their goal.
And as a certified nutritionist, do you recommend, do you look at people's diet? Do you recommend supplements? How do you go about that to fix certain digestive issues?
Absolutely, and the one thing that I ask them is what they've actually eaten in the last 24 hours. And I try and say to them, don't change things just for you know, so that I think that you're good. I want to know exactly what you're having. Most of the time, patients are having a diet that is rich in simple carbs. carbs. So lots of white product, white rice, especially in this region. White rice is a huge part of the daily cuisine. White bread, white pasta, anything that's fake, that's been modified in those terms. So I try and tell them you need to get more complex carbs in your diet. So a lot of fiber-rich foods, so green vegetables, fruits, complex carb, brown rice is fine, or any brown product is okay. And then of course have a little portion of protein, and you need those good fats as well. Often people will come to me and say, I don't want to eat avocado pear, it's fattening, or I can't have banana, it's fattening. But in actual fact, it's very, very good for you. So I always say, go ahead, you know, don't be shy to have avocado or banana. At the end of the day, it's come from the ground. It's come from the earth. It's real food. If it's real food, go for it, eat it. You need that nutritional balance. Anything fake or anything modified or processed, our bodies are not designed to break that down. And hence we suffer from digestive problems because of that.
You've heard of the lazy colon. Can colon hydrotherapists help a lazy colon?
Yes, with the flow and the pressure of the water in the colon hydrotherapy treatment, what that actually does is, first of all, hydrate, but secondly, it does increase or stimulate the muscle contraction that goes on in the colon. And a lot of people will say to me, but if I'm having colon hydrotherapy all the time, I'm going to get a lazy bowel. In actual fact, it doesn't. It stimulates and strengthens it. But of course, you don't want to have colon hydrotherapy all the time. I don't like to, if they're constant colon hydrotherapy users, once or twice every 6 months is really all that they need.
As a patient who's interested right now into coming to see you, what usually goes on during the visit?
First thing that I will do is a nutritional consultation. I need to look at the bigger picture. I need to know what their lifestyle is like, how much exercise they do, what their work stress is like, if they have any stress. So it's always looking at that bigger picture, because that'll give me a very good idea how that treatment is going to go. Next thing, obviously, they'll be going to the bathroom and they'll be putting a robe on, and then they'll be lying on a table. At the end of that table, I've got my little device, and it's very easy. All the equipment that I use is disposable. It's all medical grade equipment. So there'll be a tiny speculum that I'll insert into that area, which has a tube attached to the machine and also to the waste pipe. And all that happens is I'm allowing water to flow in through the rectal area during the entire treatment, and it goes in a flow. It's constantly going in and going out. It's not painful in any way. Obviously the first time it can be a little bit uncomfortable because you don't know what to expect, but at the end of the day it's water therapy. Water therapy is very therapeutic, very relaxing at the end of the day. And again, I always tell people, make sure you go to someone who's properly trained, because even I've been to treatments where it's been very uncomfortable. So make sure that that practitioner is properly trained, because then they will know how to alleviate symptoms. For example, if that patient has a lot of gas, there might be a little bit of cramping, but that's quite normal. It's very easy to work that out.
One last question I'd like to ask you. If someone was to ignore their colon health, what could be the side effects later in the future?
Oh, I could go on for hours on this. Digestive health problems, cholesterol, diabetes, cancer, diverticulitis, Crohn's disease, polyps, all sorts of things. Fatigue, stress-related issues. The list goes on and on.
So it's very important to get your colon checked on a yearly basis.
Any gastroenterologist will probably tell you at the age of 50 you should have one screening, so a colonoscopy most likely, and then every 10 years after that you should have another screening. But it's very, very important to monitor what's actually happening in the digestive system, and the first thing to ask yourself is, how often do I go to the toilet? Am I bloated? Do I feel any sort of discomfort? Do I have bad breath? Am I very tired all the time? All this can be related to the digestive system.
So what might stimulate the digestive system or actually aggravate it?
There's two very simple reasons why we can aggravate or stimulate the digestive system. And if you think of it in simple terms, I'll break it down for you. You've got your sympathetic nervous system, okay? Think S for stressed. This one is aggravated when we multitask around eating food. So you're walking around and eating, driving and eating, watching TV and eating, talking and eating, okay? All of these factors, while we're trying to eat, will stress the nervous system, therefore stress the digestive system, okay? You will not digest. Your body goes into a fight or flight syndrome. The other aspect is the parasympathetic nervous system. Think P for peaceful. This one is stimulated when we focus wholeheartedly on the food in front of us, okay? So focus on it, sit down, just take a few deep breaths and forget about what's going on around you. And take 10 minutes each day over your meal to do this. What will happen then is your body will rest and you'll digest. Very easy.
Okay. Any home remedies you could help for the colon?
Home remedies: drink more water. Always hydrate your body. Drink a glass every hour. Drink more, eat more fiber-rich food. So lots of green leafy vegetables, lots of brown whole grains. Protein. Try and avoid eating too much red meat. Focus more on steamed fish or chicken, grilled chicken. Keep it simple. That's all it is. And remember, the size of your stomach is only about the size of your fist. So each mouthful or each plate of food really should be no bigger than 2 fist sizes. Okay? Break that down by chewing very well. That's very important to become 1 fist size. That's all. That's the portion size of your meal. And eat something small every sort of 3 hours. So eat little, okay, but more frequently. That's the tip.
Okay, this information has been very informative. Would like to have you again on the show. Thank you for tuning in to eZeLiving.com, and we'll talk to you soon.